Thank you very much for staying with us. The South African Medical Association has raised concern on the strain that medical doctors face during the festive season. To talk more about this is the association's chairperson, Dr. Mvuyisi Mzukwa. Good evening, Doctor. Thank you very much for joining us on The Full View. Very concerning indeed. There are a number of cases that would be reported around the festive season. We've seen even just the data on the number of accidents on our roads. Just talk to us about your concerns.
Good afternoon to you, Mfundo, and to your viewers, and thanks for having me, and compliments of the season. You understand that this is a festive season like any other, but you understand that during this time there's usually increased consumption of alcohol due to, this is increased by obviously the celebrations and the social gatherings and all these holiday events that normally happen in this. The problem is that this excessive drinking during this time can lead to, several dangerous consequences, both for a person and also society at large. And like you said in your introduction, there's issue of road traffic accidents, where you find that, there's a spike in driving under the influence of alcohol, but also this leads to, fatal crashes, injuries and fatalities. But also there's also the issue of violence and assaults. Usually alcohol causes that, it lowers the inhibitions. You can't control yourself. This leads to then aggressive behavior and also this domestic violence that we see. But also the increase, obviously, in sexual assaults, during this time. So that's the picture that I could paint for you regarding this period in time.
Mm-hmm.
But we also have this what we call alcohol poisoning, due to binge drinking. And binge drinking, Mbundo, we're referring to a person taking more than 60 grams of alcohol all at once. And you can imagine what is going to happen to that person.
I love that you mentioned the binge drinking element, because just yesterday we were speaking to another medical practitioner on acute liver failure, where we learned that actually one can suffer from liver failure in just one instance, where one would probably be mixing alcohol with energy drinks, that somehow doesn't allow you to listen to your body, and you wouldn't even know that your body now has consumed too much alcohol because you've got the stimulant that makes you think you still can take on more alcohol.
Exactly. No, that's quite correct. There are so many of these acute conditions that you could get from this. I mean, like you said, you could damage some of these vital organs like the liver, but also you could have seizures. Some of these people, when they taken lots of alcohol, they even go to the beach. You find that there's increase in drownings. During this period, because there's this challenge of of poor judgment, and that causes problems for everyone.
But doctor, does it seem as though alcohol is in fact central when we speak of the number of cases that doctors would have to attend to in hospitals? Because you're talking here of, be it the accidents we're seeing on the roads, you're talking of sexual assault, you're talking of just general assault among community members themselves and the drowning. Do you see that, insofar as data is concerned, that alcohol is mostly central or the contributing factor?
Yes, you are quite right. Actually, if you look at a global picture, there's a report now that has been released by the World Health Organization. The World Health Organization says just in 2019 alone, there were 2.6 million deaths due to alcohol, and 2 million of that were men, and 600,000 were females. Now, if you come to our country, we've got about 10,000, more than 10,000 fatalities on the roads. And at this point in time, we usually run around 1,500 or so. And 1/3 of that is due to alcohol. And like you said, alcohol is always central to these challenges that we're facing. And that report then talks to the fact that even though nations have the number of nations that have adopted national policies on curbing this, has increased from 13% to 56%. The problem that the report decries is the fact that there is poor implementation. In other words, as a country, we get excited that we have this policy, but we do not implement, and as such, we then put pressure on our healthcare system, which, as you know, is really crumbling at this point in time.
Indeed, Doctor, thank you very much for joining us on the program. That's Medical Association's Chair, Dr. Mvuyisi Mzukwa, speaking to us there.